This video is going to be on tests of the coagulation cascade and how we use those tests to identify why a patient is bleeding or identify those patients that have a bleeding tendency. So prolongation of any of these clotting times means that a patient has a tendency to bleed. They're more likely to bleed. So first I'll start with the PTT and the ACT. The PTT is prolonged when there's greater than 70% factor deficiency within the intrinsic and common pathways. That could be either one factor or multiple factors within these pathways. ACT is prolonged when there's greater than 95% loss of one or more factors within the intrinsic and common pathways. So between these two, PTT is the more sensitive test for detecting factor deficiency. So now let's look at some causes for a prolonged PTT or ACT with a normal PT. So first of all, that could be a select factor deficiency. So a genetic factor deficiency where the animal has a defective or very small amount of the factor from birth. This could be a factor 12 deficiency. This most commonly occurs in cats, but this factor deficiency doesn't tend to cause bleeding. So you have this prolonged PTT, but you don't have evidence of clinical bleeding in a cat. However, there are other factor deficiencies that can cause clinical bleeding. Factor 8 deficiency or factor 9 deficiency can cause bleeding in primarily dogs, but any domestic species could have this disease. This is an X-linked disease, so male dogs or male animals are more likely to get factor 8 or factor 9 deficiency. This bleeding typically presents as big bleeds, and that's the same with all coagulation factor deficiencies. And by big bleeds, I mean that there tends to be hemarthrosis, bleeding into the CNS, or bleeding into third spaces, so hemothorax, hemoabdomen, or large bleeds and hematomas within the skin. Now this is different from thrombocytopenia because thrombocytopenia tends to cause small bleeds. So that tends to cause petechia and perhaps gingival bleeding, whereas coagulation factor deficiencies result in big bleeds. Okay, so that's one cause for a prolonged PTT or ACT. The next cause is early DIC or early disseminated intravascular coagulation, and you'll learn more about this test in a future video. And then finally, prolongation of the ACT, but not the PTT, can result from marked thrombocytopenia, so a platelet count less than 10,000 per microliter. And that's because the ACT test is run on whole blood and it requires platelets for the test to actually work. The PTT test, however, is run on citrated plasma, and it just requires plasma in the absence of platelets to function. So that's it for this video. I'm going to pick up the next video with the extrinsic pathway.